Cancer is killing more people every year and soon will be the leading cause of death worldwide of an estimated 22,000 persons per day. One question we might ask is, why was cancer so rare in the past? Another good question is, why would a creator or nature design our cells in such a way that they have this tendency to become malignant, which is uncontrolled growth? What you may not realize is that cancer cells are being produced in our bodies all of the time. Under normal circumstances, these cells are taken care of by the immune system and other mechanisms in the cell. The truth, then, is that we always have cancer cells, and it isn't something unnatural at all. These aberrant cells are likely there for a reason, and probably are a survival mechanism, rapidly altering genetic information in a stressful environment. If we look at cancer from this perspective, it would seem the reason the incidence of cancer is increasing is because of the numerous assaults on our body that occur now in our present environment. This includes toxins and pollution, low nutrient diet, lack of exercise, stress, emotional trauma, and spiritual warfare. One of the problems is how our medical system defines cancer and the methods used to treat it. I see reports of all of the cancer survivals we have in this country. In the present system, we identify cancer as the enemy and then immediately attack it with all the lethal means we can employ. Rarely is there any thought given to the cause. Looking at all the cancer survivors, we get the impression we are making progress in conquering the disease. The statisticians have conveniently added skin cancer survival rates into the statistics. This gives us the impression that millions of lives are being saved. The flaw with this is skin cancer is rarely fatal. Another reason people are living longer after the diagnosis of cancer is because of the intensive screening that's going on today. We are identifying cancer earlier, sometimes diagnosing a cancer that our own immune system may have taken care of on its own. This makes it seem as if the person lives longer after the diagnosis, but actually the person might die sooner due to side effects of the treatment. You can see how we would call this unnecessary treatment a success, and how it would be classified as a statistical victory. The reality may have been years of productive life taken away. Now, I'll grant you that there have been some tremendous successes with modern cancer treatment. But if you look at the overall mortality rates from cancer, there's been no significant change in the past 50 years. Such little progress suggests that our trillion-dollar cancer industry is a failure. Chemotherapy treatment is used because it makes money. There are many alternative cancer therapies that are likely more effective and certainly far less toxic, but they're commonly banned by a treatment by the FDA. They are banned because they've not gone through the $100 million FDA approval process. Most of the treatments that do go through this process are man-made poisons. They kill both the cancer cells and the normal cells. And they can be sold at monopoly prices, and that makes back the initial investment of $100 million. So let's take an example here. What if an onion cured cancer? It would be banned as a treatment that your doctor could use unless someone forked over the money to get it through the approval process. So it's very plain to see, with the evil, money-grubbing system we now have in place, we can never have a safe, inexpensive, FDA-approved cancer therapy, even though I believe there are hundreds, if not thousands, of potential treatments out there. Obviously, it makes more sense to prevent cancer in the first place. But the problem is there's no big money to be made here. No complicated and expensive drug, no machine to sell, no treatment to sell. The billions of dollars of research for cancer are focused on finding a man-invented cure. Children's cancer rates are rising in direct relationship to our exposure to more and more toxic chemicals. Tons of money goes into cancer research, but the chemicals that we're exposing ourselves to and our children are unstudied. This is truly absurd. I try to take a different approach with my patients, focusing first on lifestyle for prevention. And if cancer is identified, I don't recommend blindly following the recommendations of those that profit from the illness. If a cancer is large enough to be identified through symptoms or screening tests, it's likely been in your body for a long time, up to 10 years. And there's not usually an urgent need to treat it quickly. So the first step after cancer is discovered is to do a survey for possible causes. This would include an evaluation and treatment of nutrition, detoxification, and a search for toxic emotions and stress. Next, we would look for options and see if alternative cancer therapies might make sense, or might be considered, or may be done in addition to traditional cancer therapy. The unfortunate truth is, if you've been treated with chemotherapy or radiation, you have a much greater chance of getting another cancer or some other serious condition because of the unavoidable damage to your immune system these treatments cause. The shortening of your life as a result of these treatments is not necessarily included in all the cancer statistics that are reported. If you have a heart attack or die from pneumonia, it will likely not be linked to your cancer therapy, although it may very well be what caused it. I hope you can see the failing of our health system and how it is profoundly dangerous. If cancer is discovered in you, it will be thought of as a potentially lethal enemy that needs to be immediately treated with its removal and/or aggressive poisonous treatments, even if they're not proven to work. Your doctor or oncologist will use scare tactics to get you to use the profitable poisonous treatments. The truth is, if you correct the cause, the tumor may resolve on its own, just as the multitude of other cancer cells that appeared in your body during your lifetime. It could be that taking poisons is the exact wrong thing to do. If the cause of your cancer is cells trying to mutate because of a toxic threat in your body, what do you think will happen if you pile on even more potent toxins? If any of the cancer cells survive, or if new ones form, they will be even more out of control when they start to grow again. Even if the chemo or radiation kills every cancer cell, there's a good chance another cancer will start. The evidence that we're making progress against cancer is weak. And when you take into account the data that we do get is biased towards what is profitable, it's all the more apparent that we were on the wrong track. The medical industrial complex has us headed down the wrong path. I have faith that our Creator did not make a mistake in the design of our body and our cells. He didn't include a self-destructing cell. Cancer is not the enemy. It's a message telling us that we need to make a radical change. If you'd like more against the grain health advice, please hit the subscribe button above. Thanks for watching and have a great day.